So here's a fairly detailed and lengthy shoulder massage video. Here we look at some advanced shoulder massage techniques, including massage but also joint mobilization. We look at the big muscles around the gleno-humeral joint, the shoulder ball and socket, the pecs, the deltoids, the rotator cuff. The more advanced techniques like mobilizations I'd recommend that you're a trained therapist to use, but the massage can be done to a loved one or partner. If this is the kind of content that you like, then you can find more on my Patreon channel. It's free to join up. You can find the link in the bio. I really hope you enjoy and find it helpful. Full video's up now. So let's have a look at a few different ways to get things done. The temptation for me now is to move on to scapular stuff, so I'm going to try and avoid that. So it might look like a bit of a disjointed treatment, but we're going to stick to the muscles of the gleno-humeral joint. So different options for treating things around triceps, up into deltoids, and then remembering that rotator cuff as well. So what I'm doing here is trying to just trace the rotator cuff group, infraspinatus along here, and then teres minor just along there from insertion to origin. And actually what I can feel with Kirsten is a couple of twitches there. So there's obviously a few trigger points along the way. You're going to find the acromion just there and work just under it, because we know that those rotator cuff tendons come just to that point. So slow, deep pressure. If you go much deeper than this, I'd recommend reinforcing your thumb. I won't do it so that you can see what's going on. And Kirsten, oh, did you see that? Yeah, nice big twitch there. So that illustrates that there's probably a trigger point somewhere in the middle of the infraspinatus. See it go? Yeah, probably in myofascial. Oh, there's one as well. See it along that line? There you go. Let me know if it gets too painful, Kirsten. So we would treat that with an NMT or ischemic pressure. So we'd find that trigger point again. Let's see if we can find it one more time. May have even treated it with the stroke that we did. And we'd hold some pressure on that, which we'll cover when we do trigger points. So thinking about the posterior deltoid, lateral deltoid that we can get to quite well. But don't forget, you can actually get to the anterior deltoid, and this is a helpful trick because you can use the weight, just relax your shoulder, person. So that's a common tendency, people trying to help you out, which is very kind for, but get them to relax, and then all you need to do is just push your fingers up into the shoulder, and you can get into that spot and not really have to do too much of the work. It's the weight of Kirsten's shoulder that's kind of pushing down onto your fingers, and we can work through the upper fibers of pec major into the anterior delt, down to the lateral delt, and then back. You might want to bring some mobilizations into it as well, because they can work well in that position. So I'm going to hook the fingers around, kind of up where pec major comes into the humerus. You can feel pec major, follow that along anywhere around there, and then we can start to give effectively what's circumduction. So trying to isolate the head of the humerus in the glenoid, in the socket, just to get some movement in there. This is also a kind of passive assessment, don't forget that as well, which having a feel as to how the joint moves. Don't forget the tricep as well. I think a lot of people forget the triceps. We can work into the triceps from this angle. I would be somewhere around here. I'll show you actually. So we're going to lift the arm up, leg underneath, and now we've got the triceps in front of us. It's going to be quite tender on the ventral side, the inside of the arm. So just be aware of that, veins, arteries, nerves. But we can actually put a decent amount of pressure down. We can see a couple of trigger points there again, from the olecranon process into the tricep tendons, all the way up, and then some petrissage as well. Even round to the brachialis from here, but I'm really in this position to get into some deltoids. Petrissage can work really well here. We can lift that up and work through the fibers. And by working through the fibers transversely, you can find those areas of tightness as well, the bits that really stick and don't let you go through, so we can pay some more attention there. Lateral fibers, even some anterior fibers, but also posterior with the thumb as well. All good so far, Kirsten?
Feels productive.
And what is the tendon that comes underneath there, underneath the posterior deltoid? The quite surprising one that actually inserts onto the scapula.
Triceps longus?
long-headed triceps, yeah. So I can feel that and I can trace it all the way up. In the back of the shoulder, there's a bit of a junction in there where you've got just so much going on. You've got the lats teres, major teres, minor infraspinatus, deltoids, triceps. It's all happening back there. So spend a bit of time just getting into that whole junction, working slowly deeper and deeper, trying to identify what it is you're coming across as you're feeling it, working through it. You just let me know that feels a bit uncomfortable, Kirsten, okay?
Can I come back on hip weekend?
So-
Or did you right hip as well?
We'll get to the hip. Split your shoulder first. You can change arm position as well. Puts you in a better position to work on certain things. This really opens up the inside of the arm. We can get into medial head of the triceps. Up into the posterior deltoid. And also internally rotating the arm, what do you think it's going to do to the external rotator, the rotator cuff? It's going to stretch them, yeah. So that just gives us a bit of a unique position there to work through, and we can go through transversely, again seeing a couple of trigger points, a bit of twitching, or we can go longitudinally along the fibres from origin to insertion. I will show you a bit of traction here as well. So thinking of the head of the humerus in the glenoid, we can create a bit of space in between the two, just by locking the arm in between your arm and body, holding onto the humerus, trying not to just push into the epicondyles, that can be painful, and then applying a bit of traction with a rocking motion like this, just to gap that joint in the ball and socket. You can fix the scapula in place as well, or you can even bring some soft tissue release into it, working through the rhomboids. So let's have a look in side lying then. So towel technique as well, not to be glossed over here. Kirsten, can you turn yourself side arm facing away from me? So we'll keep the towel fixed. You can roll under the towel. Perfect. Put your right knee on top of that for me. And then head up. Good stuff. I mean, similar here, but it opens up the anterior portion so we can work into that. Make sure that towel's covered. Just pop your left hand just to mark the top of the towel height. So then it almost doesn't matter really where we go. Kirsten's going to be protecting that. So this arm position, again, we know that this shoulder is a bit protracted, which we'll look at later on. But this enables us to just get into that position. I'm in a really strong position here with the arm, bit of a pec stretch, hand underneath the arm supporting, and I can use this one to mobilise again. Also, we can use that to get into pecs. We can bring that into a stretch and to work through. Need some more lotion on there, don't I?
That's good.
And we can also work through the deltoids. I'm going to show you a mobilisation in this position though, because we talked about if the arm comes into abduction, what needs to happen is a little bit of glide. Supraspinatus is going to pull the head of the humerus down to stop it from clashing onto the acromion. Sometimes that's not happening, that's why they're getting the impingement. I know Kirsten's not got impingement, but this is a technique that you can use to help that to happen manually. So stay nice and relaxed for me, please. You're supporting the arm here, their arm trailing on your forearm, fixing the humerus where it is, and then bringing them to flexion. Make sure they're relaxed because they can help you out with this. We need them to stay nice and relaxed. And as they come up into about 90 degrees, we're pushing down the head of the humerus underneath the acromion. So pushing down, keeping that finger in, pressing into the deltoid, and then coming back, working through with mobilisations.
When you say pushing down, you mean you're like physically pushing the down to the floor?
Pushing the head of the humerus, yeah, underneath the acromion.
Oh, right.
So it needs to glide in that way to
Right.
allow the space in the joint. So as Kirsten comes forward in flexion, I'm actually pushing back here, pushing that down. As long as it's not painful, I'm not really too pokey there, I'm just putting a bit of pressure. We can have a look at other mobilisations as well. We'll focus on different ones when we get into the scapula. But this position here, which would be a lat, STR, lat MET that you'll do tomorrow, that's something that we can use as well. Just fixing that scapula where it is, and then bringing it to flexion. All feel okay?
Yeah, that feels tight. That feels good.
Yeah, it's Muscularly tight.
Yeah.
You can use an MET with this as well, which you'll learn. We can use some STRs as well. Trying to bring it into one holistic treatment. Into the lats. Someone name some of the muscles that you think I'm working into down here.
Lats.
We got lats,
You got
infraspinatus, teres minor, probably a bit of triceps in there as well, posterior deltoid, everything that came up on the list that Kirsten needs work on. Also, ultimately, she needs more flexion. So just cut straight to the chase and give her some more flexion, which is what we're doing. The helpful thing as well about this position is that we can then, let me know if it gets painful, we can actually bring in some rotation as well. It's just having a play around in these positions and seeing what you can do. Are you going to ask me something there? What have we got left to look at? Supine. Okay, so put yourself on your back, keep the tail raised again. You can roll underneath and then pop your knees up across from there. So muscles of the shoulder now that we've got access to. What have we got around here? What did we say about the anterior deltoid? What's underneath there?
The tendon for the biceps.
Long head of biceps, yeah. So as you're working through there, don't forget that. It might be particularly painful as we cross over that, so don't get too fixated with working into that because it will be painful for everyone. Also, crucially, we've got pec major that comes across here. And that comes across and actually comes just below the greater tubercle, so you'll be able to feel that tendon all the way quite a bit further down the arm than you might have expected. So we can do some work through there as well. And again, I'd encourage you at this stage to bring in some STRs and some movement there. So we'll begin passively just seeing what Kirsten can do. And then we can try and build on that with some STRs into pec minor and also into pec major. So last one then I'm going to show you, again very basic, but it's just a very straightforward mobilisation of the shoulder joint. So we're just going to try and fix that head of the humerus and we're moving, which is effectively circumduction, but we're just thinking about X-ray specs time, thinking about the head of the humerus and the glenoid. Trying to move it around backwards, up, forwards, down, and everything in between. Whether it achieves much we can reassess and see, but I think it feels quite nice. Does it feel alright, Kirsten? There's a tendency to poke in, you can see with the finger marks, so try and keep it broad fingers when you go. Try not to allow too much shoulder girdle movement there as well.